The purpose of this video is to give in-depth details and information regarding a few types of widely commercialized semi-solid dosage form that can be found on the market shelf. First, we have Drapeline cream. Drapeline cream is a smooth pink cream that comes in a 55-gram tube. It contains benzalkonium chloride 0.01% and cetrimide 0.2%. Benzalkonium chloride and cetrimide function as an antiseptic which kill bacterial cells. Because of that, patients are advised to not use this product if they are allergic to benzalkonium chloride, cetrimide, lanolin, or any of the other ingredients in this product. Drapeline cream is used for the treatment and prevention of nappy rash redness, for relieving nappy rash, and for use as an adjunct to baby care hygiene for prevention of nappy rash, and for the aftercare of small areas of the superficial burns, which limited to epidermis, which is the thin outer layer of the skin, limited sunburn, and the effects of weather. What you should do before using Drapeline cream? First, you should check for any allergies. Do not use if you are allergic to benzalkonium chloride, cetrimide, or any of the other things in this product. Number 2, clean the affected area and dry thoroughly before applying. Number 3, for use in newborn babies, infants, and children, wash and dry the nappy area thoroughly each time after changing the nappy. And lastly, the affected area should be free from soap residue in order to achieve optimum effect. For tips on using Drapeline cream, first, a thin layer of cream should be applied evenly across the affected area. The cream should be applied several times a day, as necessary, or after every napkin change, paying particular attention to the folds on the skin. Apply the cream when needed. If you forget to use it, use the cream as soon as you remember, for example, in the next nappy change. Overdosage is unlikely due to the low doses of benzalkonium chloride and cetrimide in the product. If this cream is swallowed, contact your doctor for advice. There are several precautions one should consider before using Drapeline cream. First, Drapeline creams is for external use only. Second, do not use Drapeline cream after the expiry date, which is the month and the year printed after EXP on the box. Third, avoid getting this cream into the eye or into the contact lenses. Fourth, store the medicine below 30 degrees Celsius and keep this medicine out of the reach of the children. And lastly, do not dispose the medicine via wastewater or household waste. Drapeline cream may cause skin rashes, redness, and skin inflammation. If the patient develops any of the symptoms above, or if the condition worsens or does not improve within 7 days upon using Drapeline cream, the patient should stop using this cream and see the doctor. Okay, right now I'm going to show you how to apply Drapeline cream onto the skin. But before applying Drapeline cream to the skin, we must make sure that the affected area is already clean. And for optimum effect, the area of application should be free from the soap residue. And if you want to use Drapeline cream for newborn babies, infants, and children, the nappy area should be washed and dry thoroughly at each change of nappy. Okay, first we open up the lid, and we can see the inside, and then apply a little bit amount of Drapeline cream, and then smear it onto the hand and apply a thin layer of Drapeline cream and rub until there is no residue left on the skin. Now that's how we apply Drapeline cream onto the skin.
Adapalene. Adapalene is a retinoic acid medicine. It is a derivative of vitamin A. What is adapalene is used for? Adapalene is actually a cutaneous treatment of acne vulgaris where comedones, papules, and pustules predominate. It is also suitable for face, chest, and even back acne. Also, It is one of the best preventive anti-aging ingredients around. How does adapalene works? Adapalene works by increasing the turnover of skin cells. This aids the natural exfoliation of the outer surface layer of skin and helps to unblock the pores and sebaceous gland. It is the gland that produces sebum, the skin's natural oil, and allowing the sebum to escape. It can reduce the formation of blackheads and spots. Adapalene also acts as an anti-inflammatory, reducing redness and swelling in the skin. Before you use adapalene, you must know when you must not use it. Adapalene must not be used by pregnant women or children under 12 years old age. It should not be used if you have severe acne affecting a very large areas of skin. It is also not intended for application to broken, sunburned, or eczematous skin. Also, you must not use adapalene when taking other medication. Addictive irritant effects with peeling agents, astringents, abrasive cleaners, strong drying agents, or irritant products such as aromatic and alcoholic agents. How to use adapalene? You need to use this medicine exactly as directed by your doctor or according to the instruction on the label. Do not use more or less than instructed by your doctor. Wash and dry your skin gently before applying adapalene to the affected area and to the surrounding skin. Also, apply adapalene very thinly to the whole area where you get acne once a day before going to bed. Please avoid applying to the areas of skin around eyes, lips, mouth, and angles of the nose. If adapalene accidentally gets into your eyes, flush your eyes with clean water immediately. Do not use adapalene for anything else other than the purpose instructed by your doctor. There is actually many side effects that you could possibly have when using adapalene if you had sensitive skin. For example, you could have mild burning and stinging sensation, erythema, which is the redness of the skin, dryness of treated areas of skin, mild skin irritation, scaling, dermatitis, pruritus, rash, skin discoloration, eczema, acne flares, or even we call it purging, and also sunburn. There are some precautions that you need to know when you're taking adapalene. You need to avoid exposure to excessive sunlight and UV irradiation. You also need to protect treated areas of skin from sunlight with sunscreen or clothing while using adapalene, even on a bright but cloudy day. Do not use sunbaths or sun lamps. Also, do not apply on broken skin, such as cuts and abrasions, sunburn, or even inflamed or irritated skin. There are some tips when to apply adapalene. Firstly, using SPF. You need to wear sunscreen every single day and avoid direct sunlight. You need to wear adapalene before going to bed, which means you only need to wear adapalene in the night time. Next is concentration. Start using lower concentration of adapalene until your skin can tolerate. For example, use 0.1% adapalene up to 0.2 and then 0.5 and 1% of adapalene. This can reduce the side effects when using adapalene. Lastly, you can mix your adapalene with other emollients. You can mix adapalene with moisturizer to avoid skin irritation and also to avoid the adapalene contact directly to your skin.
This Voron Plus gel, it is a colorless transparent gel that comes in a 20-gram tube. It contains diclofenac sodium 1% and menthol 3% as active ingredients. Voron Plus gel belongs to a group of medicines called non-steroidal anti-inflammatory agents which reduce pain and inflammation. What Voron Plus gel is used for? Firstly, it is used for the topical treatment of inflammatory or pain condition caused by chronic rheumatoid arthritis, which is a chronic small joint disorder. Second, used for degenerative arthritis, which is a joint disease caused by inflammation, breakdown and loss of cartilage of the joint. Third, soft tissue rheumatism, which is a joint disease that clinically related to tendon, ligaments and other soft tissues. What should you do before using Voron Plus gel? Firstly, check for any allergies. Do not use it if you are allergic or hypersensitivity to diclofenac, propylene glycol or any other ingredient listed in this product. And do not use it if you experience hypersensitivity reactions such as symptoms of asthma, allergic rhinitis or urticaria, hypersensitivity to aspirin or other non-steroidal anti-inflammatory drugs. Tell your doctor if you have ulceration, bleeding and perforation of the stomach, dyspepsia, heart disease or stroke, fluid retention, edema, high blood pressure, smoking and drink alcohol. And tell to your doctor if severe skin reactions like exfoliative dermatitis, toxin epidermal necrolysis, Stevens-Johnson syndrome, and skin blister, also skin peeling occurs. How to use Voron Plus gel? First, depending on the size to be treated, apply sufficient amounts of Voron Plus gel 3 to 4 times daily on the affected areas and rub in gently. Second, use as directed by your doctor or pharmacist. How long to use it? Okay, so it's apply as what your doctor or pharmacist asks you to do so. And lastly, if you forgot to use it, apply as soon as possible and continue your treatment as usual. So the precautions here are: avoid getting into contact with your eyes or mucous membrane, skin wounds or open injuries. For external use only, store the gel at temperature below 30 degrees Celsius. Protect from light and moisture. Avoid showering after applying this gel at least 1 hour, and avoid taking during pregnancy because it may affect the cardiovascular system of the fetus. Lastly, the side effects. It can cause itching, reddening, smarting of the skin as well as rashes to your skin. Guys, now I'm going to apply Voron Plus gel onto my wrist. So firstly, open the cap and use your clean fingertips. So you squeeze only a small amount of gel like 2 grams and close the cap back. Then you apply the gel around your wrist and gently massage it to ensure better application to the entire affected wrist. When you have done rubbing, so this means you are done.
The fourth product is Vaseline Petroleum Jelly. First of all, what is Vaseline? Vaseline is the name of a popular brand of petroleum jelly. It is a mixture of minerals and waxes that are easily spreadable. Vaseline has been used for more than 140 years. White petrolatum USP 30% is the active ingredient of Vaseline, which has skin protectant purpose. Vaseline has a sleek and filmy consistency, but unlike other forms of petroleum, Vaseline is safe to use on your skin and hands. It is even a favorite for some as a moisturizer. So what is Vaseline used for? Firstly, it is to heal minor skin scrapes and burns. Secondly, moisturize your face, hands and more. Thirdly, prevent diaper rash. Fourthly, preserve perfume scent. And lastly, it is for beauty purposes. These are the things that you should do before using Vaseline. Allow the skin to dry properly. Check with your doctor if you had any allergies and also around the nose area, especially in children. Make sure you clean the skin properly before you apply the Vaseline to reduce the risk of breakouts. Special precaution to the people who use Vaseline out there.
Do not put the Vaseline on the injured skin. The skin naturally forms a protective film after an injury, which helps prevent further damage and infection. Petroleum jelly interferes with the formation of this film. People with acne or sensitive skin should avoid using Vaseline on acne-prone areas, such as the face. Vaseline is flammable, so people should avoid using it near fires, when smoking, or near other open flames. Vaseline has side effects, which is firstly allergies. Some people are more sensitive and can develop allergies if they use petroleum-derived products. Infections. Not allowing the skin to dry or cleaning the skin properly before applying the Vaseline can cause fungal or bacterial infection. Aspiration risk. Inhaling mineral oil may cause aspiration pneumonia. And lastly, clogged pores. Some people may break out when using petroleum jelly. The precaution of the Vaseline. Stop use and ask a doctor if condition worsens or had symptoms last more than 7 days or clear up and occur again within a few days. Keep up or fridge of children. When using this product, do not get into eyes. And Vaseline is for external use only. I will show you how to use Vaseline. First, make sure your hands are clean and clear. Then, scoop fingertips through the jelly and spread across. Especially dry areas on skin until it absorbs.
Next, I will talk about Nixoderm. Nixoderm is a very light yellow, opaque, homogeneous, unctuous mass having a faint odor of menthol. It is a firm ointment that adheres to the skin and formulated to keep the active ingredient in contact to the skin for the maximum amount of time. This ointment comes in two different strengths, which are 5.34 gram and 17.7 gram. There are three active ingredients, which are 6% of benzoic acid, 2.5% of salicylic acid, and 4.6% of precipitated sulfur. Benzoic acid provides good antifungal properties. Salicylic acid is a keratolytic agent which treats and prevents acne, while precipitated sulfur is a mild antiseptic, antifungal, and parasiticidal agent. So what Nixoderm is used for? According to previous ingredients, it is suitable to treat infections such as eczema, pimples, rashes, foot itch, and many more. Are there any ingredient in this product that you are sensitive to? If no, then you can use this product. If yes, this product is not suitable for you. Next, if you have an extreme sensitive skin, you are recommended to apply just a thin layer of petroleum jelly over the affected areas before applying the ointment. This is because the ointment gives a slight smarting sensation. And if you are on medicines with tretinoin and hydroquinone, avoid this product because currently there have been reports of problems when this product is used with those ingredients. I'll guide you how to use the ointment. First, you have to know the pattern to use it. The pattern should be followed for 7 days, then discontinued for 3 days and resumed for further 7 days. Do it twice daily, in morning and evening. You have to make sure your affected area is clean and dry. Next, apply an adequate amount of the ointment onto the affected area. Continue the pattern until the condition has cleared up. For ringworm, it is recommended to continue as long as it necessary, while for foot itch, it is recommended to continue for 3 weeks after symptoms have disappeared. When using this product, there are precautions that you have to take note. Firstly, you have to avoid contact with your eyes. If it happens, rinse your eyes with running water. Secondly, if any irritation occurs, discontinue the product. Then, this product is only for external use. This product should be stored at 25 degrees Celsius in airtight container and protect from light. Keep out of reach of children. And lastly, do not apply to broken or inflamed skin. So,
I'm gonna show you the method to apply the ointment on your face. But firstly, you have to make sure your hands are clean and dry. Firstly, open the cap of the can. By using your fingertips, take a little bit of the ointment, close back the cap. Then, as you can see, there is a pimple under my lips, so I put it on the affected area as thin as I can on my face. Yep, that's all. Thank you.
Assalamualaikum and hi, my name is ZARIFAH EDORA and I would really love to introduce you to hydrocortisone cream. Firstly, what is hydrocortisone cream? So, hydrocortisone is a pharmaceutical term for cortisol used in oral administration, intravenous injection or topical application, but I will be specifying to hydrocortisone topical. Next, what does hydrocortisone is used for? So, mostly hydrocortisone topical is used to treat redness, swelling, itching and discomfort of various skin conditions. Well, maybe caused by allergies or any other diseases. So, hydrocortisone is in a class of medications called corticosteroids, which it works by activating natural substances in the skin to reduce the swelling, redness and itching. So how does hydrocortisone actually works? So hydrocortisone is a steroid, also called a corticosteroid, which I've mentioned before. The steroids help to reduce swelling, which is inflammation in the skin and other parts of the body. The skin gets inflamed when an allergic reaction or irritation causes chemicals to be released in the skin. So these make blood vessels widen and the irritated skin becomes red, swollen, itchy and painful. So that answers why you have irritation and swollen skin. Hydrocortisone skin treatments work on your skin cell to stop these chemicals being released. So this reduces the symptoms like swelling, redness and itching. So what are the special precautions before using hydrocortisone topical? You need to tell your doctor or pharmacist if you are you have allergies to hydrocortisone, if you have diabetes or Cushing's syndrome, and lastly, if you are pregnant or planning on one. So Cushing's syndrome is caused by excess hormones, which are corticosteroids. Next, on how to apply hydrocortisone cream. So basically, hydrocortisone cream is how we actually use skin cream or ointment. So firstly, we need to wash and dry our hands and then squeeze out the right amount. So we need to spread the cream or ointment in a thin layer over the area of irritated skin and then carefully smooth it out into our skin in the direction the hair grows until it disappears. So we use the cream on all the irritated skin and not just the worst areas. Be careful on not to get the cream into our broken skin or cuts. Lastly and finally, wash your hands afterwards unless you are treating the skin on your hands. So remember, the amount of cream or ointment you need to use can be measured in fingertip units. Now let's get into the real precautions. So basically, we need to store the medication hydrocortisone cream in around room temperature. And remember to keep out of reach of children. Do not freeze the medication and do not apply double amount to make up for the missed dose. Remember that the drug may mask some infections, and do not take medication if there are ingredients that you are allergic to in the medication. Last but not least, every medication has side effects. So these are some of the side effects for hydrocortisone creams. Firstly, itching, burning, irritation, redness and dryness, unwanted hair growth, tiny red bumps, rash around the mouth, the skin color changes, acne, and lastly, small white or red bumps on skin.
that's all from us. Thank you for watching and listening. Bye.